unless you have Medicaid. Unless you have Medicaid, and there's a Medicaid bed available, then the Medicaid will pick up the room and board, the Medicare will take care of the hospice part. So we can really get into the weeds here. But I will say this, is that's where, I mean, I know a lot of these answers, and the reason I know a lot of these answers, number one, I've seen a lot of patients in this situation, but number two, I got a social worker that works with me day in and day out that keeps me straight as far as in the rules changing and things change and how things are covered and those kind of things. So that's a great question. Yes?
When you say the last days, is it the last 6 months? The doctor says you only have 3 months to live. He can put in for palliative care.
Absolutely.
Yeah.
And sometimes
And then
people,
you last longer.
right, and sometimes people aren't ready for hospice. That's sometimes a scary word for people, and they think, they get a hospice consult in, they think, I got 2 days left. I mean, typically that's not the case. And quite frankly, I think the earlier hospice is involved with patients, and the literature supports this, people tend to do better, quite frankly, because some of that stress and angst of in and out of the hospital, blood work and more testing, the angst of that is gone, and you're really focusing on the patient and making sure they're comfortable. You got a team of people coming out, more eyes on you and looking at you, a nurse, volunteers, caseworkers, social workers, and often people do better. But if you're not quite ready for that, even if we think your hospice is appropriate, but you're not ready to use the word hospice, the palliative team certainly can do those things. Absolutely. That's a good question.
The patient here typically have both palliative and hospice care.
You'd be one or the other. It would be both. Yes, ma'am. Exactly right.
And there's a mindset that all hospice companies provide palliative care. They do not. You've got to find someone who provides palliative care.
They should be.
They should be.
Yeah.
Absolutely.
They should be, because that's part of the whole thing. I mean, as I said, hospice is a subset of palliative medicine. And so they should be able to do a good job at it. Not all, as you can imagine, not all companies are made the same, and not all hospice companies are made the same. So,
And that's an excellent point, because that's why I always say, go interview. Whether you're going to do home health, whether you're going to go do hospice, go interview and see which one is the best suited for your needs. Hospice. There's this mindset that you need to look into that the very last 6 months of life. There is an assessment that the company will do to graciously help you. I want you to know you can go on hospice, you can go off hospice, you can come back on hospice, you can choose who you want for hospice, you can start a company, they don't meet your expectations, you can go find another one. That's some good education that you may not be aware of.
yeah, you can certainly, if and this happens, people sign up for hospice, they're in, maybe in a different situation, or things are a lot worse, and then things stabilize. Whatever reason, what we thought at one point is not coming to fruition, or not coming as we thought, or the decline is not what we thought. There's people that graduate from hospice, as I say, and that's okay. But what I find a lot is the reason people get better, or are feeling better, is because they have hospice involved. Is what I usually see a lot, is because the earlier they're involved, the more they can help manage symptoms, and the focus is getting patients to feel a little bit better with managing their symptoms. And that's not in any way to push hospice in here. I don't want people to think that. But I also think the reality is that the sooner they're involved, I think the better they help you. And the more they can help you, the more you get to know your team that's coming to see you on a regular basis, the more they get to know you and kind of, how to manage those symptoms and navigate through some stressful times. And so those are things that are all good things.